Welcome. Welcome to Life After Work. I'm your host, Dr. Clark Gaither. Life After Work is the source, the tool, the solution for redesigning and transforming your life when your life's work, for whatever reason, has come to an end. Today I want to talk about a problem facing our older population. Our current population in the U.S. and around the world is getting older. And as a result, there's a problem that's cropping up with increasing frequency, and that is dementia or senility. Primary degenerative dementia is something that occurs in about 10% of people. I want to talk about how to recognize the signs and the symptoms of primary degenerative dementia. Now, there are a couple of types of dementia. There's stroke dementia, which we call in medicine multi-infarct dementia. There is also Alzheimer's type dementia. And that's a loss of connections in the brain and the deposition of a compound called amyloid that occurs in people with Alzheimer's type dementia. Now, when you talk about dementia, most people think about memory loss and confusion, and those are certainly two key components of the beginning of dementia. The memory loss is usually recent memory, not remote memories, at least in the beginning. It's problems in recalling short-term memory functions. Long-term memory function loss can occur in advanced stages of dementia. Of course, there's confusion that comes along with that. One curious thing that happens early in dementia is that people who are developing it stop using the telephone. They may, if you hand the phone to them, of course they'll talk to someone, but they seem to stop picking up the phone and dialing or calling someone on their cell phone. I say dialing, that's the old way of doing it. Nowadays it's touch button with the index in your cell phone. But people will stop calling friends, neighbors, loved ones, family members, and the reasons for that are unclear. It could be they just lose the motivation to call someone, or they don't have the forethought to pick up the phone and call someone. It's interesting also that one of the early signs is if you ask someone to draw a clock face, and have it draw it such that it reads 3:30 or 8:30 or 12:45. Just pick some time, and somebody with early dementia will have difficulty drawing that clock face accurately. You can get all sorts of weird drawings of a clock face, and that's a tool that I used in my practice when I was seeing patients. And most of the time people are brought in by family members because they're concerned with the person's memory function, and I'll ask them to do the clock drawing test, and they will have difficulty with it or not. If they don't, that's a good sign that they are probably not in the early stage of dementia. There's a difference between benign senescent forgetfulness, which is, some people call it the tip of the tongue phenomena, where you know what you want to say, you just can't get to it, but a few minutes later you recall what it was you were trying to think of, like the name of a person or a movie or some place you visited. That's benign senescent forgetfulness. Dementia, on the other hand, is quite different. It is more complex, and short-term memories are essentially gone. They're not recalled at a later time. Other symptoms of dementia, early dementia, include problems with dates and times, confusion when it comes to completing tasks, also problems with directions. both following them and giving them. There's a general apathy that also comes along with dementia, where people lose interest in activities they once enjoyed or once took part in regularly. There's also a physical phenomenon that can occur. In medicine, we call it a mask facies, or someone develops a blank expression. They just sort of stare off into space much of the time. And you wonder what they're thinking, and you ask them, and they will tell you they don't know. That's usually in the middle or later stages of dementia. One problem treating dementia, and there are treatments for it, there's no cure, but there are treatments. One problem is that they usually, the person with dementia presents late. They don't often make it into the office in the early stages of dementia because they will deny that there's a problem. The family members will even though they know something's not quite right with Aunt Martha or their father or mother, they tend to slough it off and believe them when they say, "Oh, I just forgot. I just can't remember. It's no big deal." And so the disease will progress until it's glaringly apparent that there's an issue or that there's a problem, and then they're brought in to the office, and by that point they're in the middle stages of dementia. It's best, people have the best outcomes if you treat early. And so once someone is identified as maybe having a problem with short-term memory, it's best to get them evaluated as soon as possible. There are tools that can figure out whether or not they're in the early stages of dementia. And if that's the case, there are medications that can help. That can help slow the disease progression and possibly keep them out of an assisted living facility or nursing home for a longer period of time. So it's important to recognize this early, if at all possible. There are two classes of drugs that treat dementia. One is the acetylcholinesterase inhibitors like Aricept. That's a brand name, Aricept. And there's an NMDA receptor antagonist called Namenda. And you start one of those for a month, and then if the patient tolerates the drug well, then you start the other drug a month later. Those two drugs come in combination with one another called Namzaric. And when I left clinical medicine, that was the best combination of medications to give a patient with early stage dementia. I left clinical medicine in 2016. Things may have advanced in terms of treatment since then, so I would check with your primary care provider or for yourself or for a family member or friend, get them evaluated and get them, if they do have early stage dementia, get them started on some medicine as soon as possible, because these medicines can help slow the progression of the disease. I'll talk about causes of dementia, of which there's a list of causes. Of course, one is genetic, but there are environmental causes, and I'll speak about those in another video. If you liked this content, be sure to share, like, and subscribe. Also, Life After Work publishes a free newsletter at lifeafterwork.co, and there will be a link in the description box below. As you can see, I'm still in the Alps. Today I'm in Austria, and I took the chairlift up to the top of a mountain, and I believe the trail is called Zibberweg Trail from Hall over to Innsbruck. It's about a 3-hour hike along the mountaintop, and as you can see, it's just absolutely beautiful up here. I wish you could see what I'm looking at from my vantage point. It's awesome. If you ever think about coming to Germany, don't think about it, just do it. And get some hiking shoes and hike some of these trails. They're just awesome. Until next time.